Thank you, Speaker. Last week, Uganda passed a deadly law criminalizing LGBTQ+ people. On Sunday, at an emergency meeting with 150 people, I heard firsthand about the homophobic violence. Until March 31st, Ontarians without status have access to health care because of the province's physician and hospital services for uninsured persons program. Will the Premier please listen to the Ontario Medical Association and reinstate health care for undocumented people set to expire in 3 days?
Minister of Health.
Thank you. I want to be as clear as I can possibly be, because it is deeply disturbing that the NDP continue to put a false narrative out there.
Minister to withdraw.
We are returning to a funding model that existed pre-pandemic that ensured individuals who do not have an up-to-date OHIP card have access. That ensures 75 community health clinics that have funding models that ensure individuals without OHIP coverage get access. Individuals who appear at emergency departments in our Ontario hospitals get health coverage. It is deeply disturbing that we continue this narrative with the NDP opposition to suggest that there is a change that is not happening. We are returning to what we had in March of 2020. It was there under the Liberals. It was there because it assists people. Thank you.
Supplementary question, member for Nickel Belt.
Thank you, Speaker. The minister should know how disrespectful her answer was to the people that I represent, who live 4 hours away from the nearest community health centre. Yesterday, I and the minister received thousands of emails calling on the provincial government to ensure continued access to medically necessary services to people living in Ontario. These people are Ontarian like you and I, Speaker. They are not able to get an OHIP card because of systemic barriers. How is a homeless person supposed to go to Service Ontario with a proof of address? They are homeless, but they deserve care, Speaker. What is the minister going to do in the next 3 days to ensure that she removes barriers so that every Ontarian who qualifies for a health card gets one?
Members will please take their seats. Minister of Health.
Thank you. Again, I will remind the member opposite that community health care centres, midwifery care and emergency care all will continue whether that individual has an OHIP, up-to-date OHIP card or not. You know, Health 811 is another program that is available all across Ontario to ensure that individuals can speak to a registered nurse to find out about their health conditions and see what next steps is. You know, to suggest that, as they have, Ukrainian refugees are suddenly going to be without health care coverage, completely and utterly false, Speaker. And if the member opposite really wants to have credibility in this field, she needs to stand up and say that in the province of Ontario, Ukrainian refugees, individuals without health care, will have it as they had it March of 2020.